Time is precious, so I just want to say that I'm grateful that you have spent time with me. And I want to know, type in the chat what's one word that describes your day today. Tell me, like, if you had a good day, a great day. Anita had an intense day. Okay. Today I had a productive day. It was very, very productive. But I'm happy to be with you guys. And this is giving you permission to turn your cameras off. You can put yourself on mute. This is just your time to regroup during the day. The day can sometimes beat us down. And this is your 30 minutes to allow yourself to be grounded and to stay sane in this world. So I'm going to start by telling a little bit about my story, my why. I started Scrubs Unzipped because I am a mental health advocate. I also have mental health history. I was going through a breakdown in 2020. That was about 6 years ago. And all through COVID, I had to get myself back to working state again. And that is why I developed the 3 R's: regroup, restabilize, and refocus. And those things helped me get to a point to where I was so burnt out that I couldn't work. I could not do anything. Like, I was just so exhausted from the events of the world, so exhausted from everything happening that I had to do research on how to get myself back to regular normal. And I had to do my own research because people weren't really talking about burnout back then. And I had to find my resources. So that is part of the regroup, is what we're going to do today. We're going to do the first R today, and I'm going to guide you through that phase. And regroup is basically after been through a battle or after there's been a defeat, we need to regroup. And that is what I plan to help you, guide you through this for this period of time. And when we are in the hospital, we are battered with patients and codes and emergency situations, and that gives us a hyper vigilant state, and it makes us on edge. And I built the regroup section of the R's as a way to come down from that, to ground yourself and feel everything from your head, feel the chair that you're sitting in. And these methods really helped me get through a 12-hour shift. It helped me work at a children's hospital because children are more complex and they have emotional weight on them. So it's helped me a lot, and I can't wait to share it with you guys. So the first part of regroup is we are going to do box breathing. So if you don't know what box breathing is a 4-step process. And I want you to picture a square of all equal sides. And on one side there, we're going to inhale for 4 seconds. And then the other side, we're going to hold for 4 seconds. And then going down, we're going to exhale for 4 seconds and then hold for 4 seconds. So when you are in a heightened state and you just don't know what to do, as a respiratory therapist, it's really interesting that I always was taught that breathing is like, you don't have to teach people to breathe. Like, people can breathe automatically. But what I found is that some people, and I say me, like sometimes when I was in school or I was a new grad, I would hold my breath to like get blood from a patient. And that really extended, and I don't take deep enough breaths. So as I add this practice to my rituals and actually feel everything I need to be feeling and being mindful in the moment, it really helps me stay grounded so that I'm not as stressed. So we're going to do this together. And I want you to picture a square, and you can draw the square as you can draw it on like your lap or like on the table with your finger. So we're just going to do one leg at a time, and I'm going to direct you 2 times, and then we're going to do about 30 seconds on your own. So the first leg, we're going to inhale for 4. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. Hold. 1, 2, 3, 4. And we're going to inhale. 1, 2, 3, 4. We're going to hold. 1, 2, 3, 4. We're going to exhale. 1, 2, 3, 4. And then we're going to hold. 1, 2, 3, 4. All right. So I'm going to give you 30 to 40 seconds, and you're going to do it on your own. All right. How was that? I hope that was a great grounding technique. I use this when I'm at work, in between shifts, or in between rounds. And it really helps me stay centered, even though I just did it right now with you guys. Everything's okay. I'm in a safe place right now. I am okay to relax, and it's okay to take this time for myself. So, next on the agenda is I want to talk about my ventilator story. So, I I briefly mentioned that I had these stressful shifts, and it was just one moment where one of our patients was on a breathing machine, a ventilator, and for some reason the ventilator popped off. And what that means is the circuit or the tubing that connects to the machine disconnected, and the patient was not getting any oxygen or any breaths at that moment, and their vital signs started to go down, and the vent was alarming, and no one really knew what was going on, and it was an emergency, but the stats were going down, and then the people were like, what's going on? And so when I heard the vent alarm, I like immediately stood up because I know what ventilator alarms sound like. And I immediately got out and I went to the room. I assessed the situation. I was like, oh, okay, they're disconnected. Like as soon as I like walked in the room, I knew what I needed to do. I just needed to connect them back. And it was just like, oh my gosh, thank you so much for coming. And where the staff was just very welcoming and thankful that I was there at the right time and they didn't have to call a code blue. And I just relate that scenario to how in our lives, sometimes we feel like we're going to pop off the ventilator, like we're going to pop off of our life support. And I my mission is to help the person who I was 6 years ago, the person who was on the floor in the bathroom crying. I was saying, I'm so tired, I don't want to die. And that was like my last like cry out for help. And I want to be that person that I needed 6 years ago. So this is why I built Scrubs Unzipped. And because we are healthcare workers, but we're also human. And us being human, we still need to do regular activities of daily living. We still need to eat. We still need to go to the bathroom. We still need to do all of those things. Just because we're healthcare workers doesn't mean that we can deny our humanness, because we bleed just like everyone else bleeds. And I know that there is a disconnect between taking care of patients and taking care of ourselves. And I want to bridge the gap between taking care of ourselves and taking care of the patient. Because if we can't take care of ourselves, who's going to take care of the patient? And that is the most important thing. And I realized that the hospital system can roll over you, but you can't let them. And I have learned through the 6 year process of how to set my boundaries and how to not conform to the idea that I'm not just a respiratory therapist, I'm also a singer, a creator, a musician, an artist. So I'm all these things together. And when I come to work, I show up as myself. Because when I learned that when I'm asked to sing in the unit sometimes to the children. And it's just really nice to bring that gifting inside the hospital. So I want you to think about all the things that you want to happen in your life. And I want you to think about all of the dreams that you've had or that you felt like that died, because I feel like when we go to the hospital, some of our patients might not make it out. And I want this to be like an alarm sounding, like we have the opportunity to live the life that they can't live. And since that I know that I'm an able-bodied person. I have all my limbs, I have all my fingers. I am mostly healthy. I'm getting healthier every day. So I know that I can do the best I can to live the best life that's for me. And I want to help others do the same. So I want to take the last 10 minutes to go over this great resource that I created. It's called the 5 minute reset. And I poured my all into this, and I really wanted to have a resource that's easy, that's no fluff, and something that really can take you out of that moment, just like how we did that 4 breaths box breathing. There are 30 other resets in the document, in the digital download, and it varies from 1 minute to 10 minutes. So that there's 5 minutes in between. So there is enough time to decompress. If you have 1 minute, you can reset. If you have 5 minutes, you can have an escape. And if you have 10 minutes, you can decompress. You can do that after a shift, or you can do that on your day off. But I just want to stress that we are so important, and people don't know the hospital system is mostly focused on getting patients in and getting patients out, like the rotation. And I understand the business side of healthcare, but I also understand that for me to show up as a qualified, um, able bodied healthcare professional to do my job, I also need to do my job of taking care of myself outside of work so that I can show up for my patients, so I can advocate for my patients. And sometimes when you are bogged down and burned out, that's when you miss things. That's when mistakes happen. So I want to catch you before you get to that point. You are just so mentally exhausted that you can't do anything, and you're just in a hypersensitive place. And I want you to know that I'm here for you, and I am building resources for you, and it's a low cost investment. This digital download is $9. It is less than a cafeteria meal in the hospital that can make you sick. This will be the best $9 that you've ever spent. And it is a quick guide. It's a 5 minute guide. It's not long. It brings you the quick tools that I use to get to the next state of mind in my shift or in the day, so that I can be a full person, so I can show up as Anne, so I can be here for you guys, and then so I can show up for myself as well. But you can join the school community, and we will do other regroup sessions throughout the month. And when you're in this community, you get to be with other healthcare workers who are going through the same things you're going through. And it's a community that will help you get to where you need to go. But I would definitely check out the 5 minute reset. Will help you get to where you want to go. It has the one goal for the day, and it also has my personal toolkit for getting through a shift, getting through night shift, getting through working 12 hours, because it's like the clock can go slow or it can go fast. It just depends on what kind of night you're having. So I understand all the things, and we have 5 minutes left. I wanted to say thank you so much for being here. I'm really excited about all of the plans that's going to happen and all of the visions and goals. Like, I want to do a conference and I want to do a talent show with other healthcare workers doing their talents. I know all these healthcare workers have so many other gifts, and we need to make use of those gifts before we lose ourselves. And that's basically my gift to you. I hope this was a great session.